As dengue cases rise in Trinidad and Tobago, the Ministry of Health hosted a press conference today to further sensitize the public about this viral infection. Chief Medical Officer Dr. Roshon Parasram shared information about the mosquito and how it infects people. The County Medical Officer for Caroni, Dr. Jeanine St Bernard, spoke about the symptoms of dengue fever, and the Specialist Medical Officer in the Insect Vector Control Division, Dr. Osafo Fraser, listed the different breeding sites for the Aedes aegypti. Here's more.
Dr. Roshon Parasram shared that the dengue virus is not transmitted through respiratory droplets, unlike in flu-like illnesses or COVID-19.
The main mode of transmission is via vectors. The primary vectors are the Aedes aegypti mosquito, which is, of course, endemic to Trinidad and Tobago and other parts of the Caribbean, and to a lesser extent, the Aedes albopictus mosquito. The albopictus is also known as the tiger mosquito, which is endemic to parts of Southeast Asia, but we have seen it in Trinidad as well.
Dr. Parasram stated that the Aedes aegypti mosquito becomes infective 8 to 12 days after consuming blood and will remain so for the rest of its life. Dr. Jeanine St Bernard said the symptoms of dengue are a high fever of 40 degrees Celsius or 104 degrees Fahrenheit, severe headache, pain behind the eyes, muscle and joint pain, nausea, vomiting, swollen glands, and rash. She then spoke about managing the virus's symptoms.
In terms of diagnosis and treatment, there's no specific treatment for dengue, but the focus would be on treating pain symptoms. And for persons who've had dengue, they know sometimes they're at home and they would take acetaminophen, paracetamol to manage their pain. We discourage the use of non-steroidal anti-inflammatory drugs.
These drugs are ibuprofen and aspirin, as they can increase the risk of bleeding. She also noted that persons suffering from severe dengue should be hospitalized. Moreover, Dr. Osafo Fraser shared that once water is stagnant and relatively clean, female Aedes aegypti mosquitoes would lay their eggs. He said that it is easy to disrupt the life cycle of a mosquito by making sure water sources are not around.
So one of the things we recommend is you tightly cover those containers, or you can use a fine mesh to make sure that the mosquitoes do not get there. Because the Aedes aegypti mosquito actually lays the eggs on the sides of those containers, you do want to make sure that you're cleaning the sides of the barrels as well.
Fraser also advised people to properly dispose of old tires, empty plant pots and plates and turn them down, change the water in indoor vases weekly, and wash their plants weekly to prevent mosquito breeding sites. Ariana Scipio, Tobago Updates Television News.